Africa in that sense is fantastic. There's a couple, if you take really broad picture, you see that at the moment, kind of like the big powers and the big markets are shifting a bit. And I think Africa, that actually positions Africa for investors, but also for growth, increasingly in a good position. So I think that's the big umbrella. If you look at it in more detail, let's talk about growth rate, right? If you look at growth rates in the markets, for example, in Eastern Africa, they're at 2 to 3 times what you currently see in the United States or in Europe, right? So where in Europe or in the US, you're talking about maybe, although maybe it'd be lower in 2022, but let's take 2019, 2022, we're talking about 2 to 3% growth rates. In many of the markets we're talking about here, we are talking about 2 or 3 times that. So from a growth perspective, that is exciting. We were just talking about population, indeed. Again, similar. If you look at the US and Europe, you're looking at flat or very low population growth rates. If you look at the Eastern African markets, again, by example, you're talking about something like 15% or 20% population growth. And that population is very, it's very young, it's talented, and it's digitally savvy. So that from a talent, but also a growth perspective, makes it a very exciting market, and also an exciting market where you could leapfrog. The concept of leapfrogging has been spoken about before, but where you could leapfrog from an existing status quo and how the healthcare system is organized to really a future-proof ecosystem for healthcare, where many markets in Europe and in the US actually are dealing with a lot of legacy, need to go through different stages. We can actually immediately make the step from where the country is today or the markets are today to a fully digitally enabled situation. I think the third part, which is really interesting, again, if you look at it in markets like Europe or the US, people are often expected, there's often a situation where you're looking at close to 100% insurance, right? Where people are insured for costs they will incur in healthcare. If you look at the situation at the moment in Africa, that number is probably more like somewhere around 10 to 20% at best, which means that 8 out of 10 people are not insured for unexpected healthcare expenses they will have. And that's either because they chose not to take an insurance, or it's either because they cannot afford it. Now, from a marketplace perspective, that actually creates a lot of opportunity to improve, right? Because all these people are spending on a regular basis money from themselves or money from others on healthcare services, and being able to use a platform for that to do it efficient and get the best quality is, of course, a big opportunity.